Hey guys, today I want to talk to you about treatment options for osteoarthritis of your knee. Now guys, this right here is a knee, and you see this inside portion of the joint there's an area called a meniscus, and a meniscus is a cushion. And you see this joint right here, there's a little capsule that wraps around it, and inside of this joint is filled with a slippery fluid called synovial fluid. All right. Now this acts like WD-40. It allows your knee to glide without friction building up in it. Now the very first stage of osteoarthritis is that you lose that natural lubricating liquid. And then once friction builds up in the knee joint, over time this meniscus and the cartilage will start to become dry and brittle, and then it will start to wear away. And on x-ray you'll see that as a decreased space between these two bones. Now the problem is that when you go to your primary care or your family doctor and they refer you for just physical therapy, well, physical therapy is great to strengthen the muscles that surround the knee joint, but what about the inside part of the knee? And so you're wondering, hey, Dr. Josh, why do you have these sponges? Well, I want to prove a point to you guys, okay? Now, I want you to picture that these two sponges are the meniscus, the inside part of that knee joint. Now, if you're experiencing osteoarthritis, your inside part of your knee is just like this dry and brittle sponge. When you go to move it, oh, look at that. You could get a meniscus tear. When you're dry and brittle, that knee can't bend. So what happens is when you're doing all of this exercise, yeah, you may be strengthening the outside part of the knee, but the inside part of the knee is still dry and brittle, and it still will cause a lot of friction and a lot of pain. Now, what we do at our office is, you see, when you come in with a dry inside knee like this sponge, well, we do these injections of artificial synovial fluid, that slippery WD-40 type material. And we make the inside part of your knee thick, like this hydrated sponge. And because the inside part is hydrated, you can start to bend. And you'll start to know increased range of motion within your knee joint. It's going to decrease a lot of that friction, so it's going to decrease all that swelling and pain that you feel. Now, combined with the physical therapy to strengthen the outside part of your knee and deal with the weak muscles that you've been compensating for years and years, we get an outstanding results. In fact, 98% of our patients report an 85% or higher reduction in their pain symptoms within their knee. So guys, when you combine sports medicine with physical therapy, you get outstanding results.